Hello friends, welcome to my channel Breathful Lung Care because every lung and every breath matters. Today I am back with very interesting sign called as the Monod sign. In the previous lecture we have already discussed about air crescent sign. So in today's lecture I am going to discuss what is Monod sign, how it looks like, how to identify Monod sign radiologically on chest X-ray as well as on CT scan. What are the conditions in which Monod sign is present and what are the differences between the Monod sign and the air crescent sign. So let us start with the today's lecture. So let us discuss with a very simple example. A 70-year-old male patient presented with a symptom of hemoptysis for 10 days. There was a history of pulmonary COX 15 years ago for which he took complete treatment. In the CT scan of the chest, there was an irregular shaped cavity in the right apical zone with an oval-shaped mass within it. The mass was separated from the wall of the cavity by the crescent-shaped air space, and it is known as the air crescent sign. So we already discussed air crescent sign in the previous lecture. If you want to know air crescent sign, about the air crescent sign, the link is given in the description. You can click out there and you can watch that video. So though this finding is typical of the pulmonary aspergilloma, this can also be found in the pulmonary tuberculosis, hydatid cyst, pulmonary abscesses, bronchogenic carcinoma and pneumocystis carinii pneumonia. Then what is Monod sign? So in the pulmonary aspergilloma, the mass is usually moves within the cavity when the patient changes the position, and this sign is called as the Monod sign. It means the Monod sign is gravity dependent. So when the patient changes his position, the mass usually moves within the cavity. So this is a very specific feature of the Monod sign, and this is the main difference between the Monod sign and the air crescent sign. So that's why we have to perform the CT scan of the patient in the prone position to see whether it was whether that mass is moved to the dependent area or not, and this definitely confirms the diagnosis. Okay, this is a contrast enhanced CT scan of the patient which shows the irregular shaped thick walled cavity with a oval shaped mass and a crescent shaped air space which separates the mass from the cavity wall, and this is known as the air crescent sign. So here is the cavity, which is a preformed cavity which is present here, and this is the soft tissue mass which is present here, and this mass is separated from the wall of the cavity with the crescent of the air. So this sign is called as the air crescent sign. So this is a one more CT scan of the patient which is performed in the prone position. So in which there is also one pre-existing cavity and there is a soft tissue mass which is present here, and that mass is separates from the wall with the crescent of the air. But the difference between these two CT scan is this mass or the mass in this CT scan, it moves to the dependent portion or dependent region of the cavity, and this is the specific feature of the Monod sign. This is a one more CT scan which is a specific of the Monod sign which is seen in the pulmonary aspergilloma. So as you can see, the green arrow which suggests rim of the air surrounding the mass in a pre-existing cavity. Red arrow shows the mobile mass within the cavity, and the blue arrow shows the mass gravitates to the dependent portion of the cavity in the prone position. So this is a typical sign called as the Monod sign which is commonly seen in the pulmonary aspergilloma. Then very important, between what are the differences between the air crescent sign and the Monod sign, because they are nearly same. Okay, so first differentiating point is in the air crescent sign, crescentric or the circumferential rim of the radiolucent air space which is present within the parenchymal consolidation, and the Monod sign is the air surrounding a fungal ball in a pre-existing pulmonary cavity. Air crescent sign is commonly seen in the invasive pulmonary aspergillosis, bronchogenic carcinoma, whereas Monod sign is commonly seen in the aspergilloma which is also called as the fungal ball. Air crescent sign is a non-mobile. Monod sign, the mass within the cavity is mobile, and as the mass within the cavity is non-mobile in the air crescent sign, there is no positional change. The mass gravitates to the dependent areas of the cavity in case of the Monod sign, and air crescent sign is most commonly seen in the immunocompromised patient, whereas the Monod sign is commonly seen in the immunocompetent patient. So this is all about the monad sign and air crescent sign. I hope you all understand what is monad sign and air crescent sign, and you all will be able to identify monad sign and air crescent sign radiologically on chest X-ray as well as on CT scan. So please like and share this video and subscribe to my channel. In the next lecture, I'll be back with one more very interesting sign. Till then, bye bye. Thank you so much.